They kept her isolated for 3 days, but officials in New Jersey couldn't keep Casey Hickox quiet. On Friday, the 33-year-old nurse arrived in New Jersey after spending a month in Sierra Leone treating Ebola patients. Under a mandatory quarantine policy announced by Governor Chris Christie the same day, Hickox was forced to stay in a tent outside a hospital with no working shower, even though she tested negative for the disease. The mandatory quarantine was meant to last a full 21 days, which is the incubation period for Ebola. But after making a public appeal in the press over the weekend, Hickox was allowed to make the 600-mile trek from Newark to her home in Fort Kent, Maine today. Despite reversing the quarantine order, Governor Christie defended his actions.
I know she didn't want to be there. No one ever wants to be in the hospital, I suspect. And so I understand that. But the fact is, I have a much bigger responsibility to the people, the public. And so I think when she has time to reflect, she'll understand that as well.
Before her release, Hickox threatened to file a federal civil rights suit. And my next guest says she has a strong case. Wendy Parmet is a professor of health policy at Northeastern University School of Law. Welcome to Greater Boston. Or I should say back, Wendy.
Thank you.
So I almost, until I saw this for myself, didn't believe the details of this, that it was a tent outside the hospital, no heat, no sophisticated facilities, just some kind of a porta potty. I mean, what was your take on that?
Well, my take is that it was quite an overreaction, and an overreaction that was really dangerous for public health. Governor Christie claims that his concern is protecting the public's health. And that's what it really, that's the most critical thing at this moment. But overreactions that don't follow the science, that really are treating healthcare workers more like criminals than like the heroes that they are.
Yeah, this had been a volunteer in West Africa.
We need people. We need our healthcare workers to go to West Africa. We need our healthcare workers to show up tomorrow morning at Bellevue. And if healthcare workers are left to think that they're going to be left without a shower for 21 days, we are undercutting our ability to protect the public's health.
All right, now, this afternoon, the CDC issued new guidelines. It said people coming in from West Africa with a high risk of chance of exposure should be contained to home confinement. That is their recommendation. But the Obama administration countered by saying, look, we have no authority to enforce or force states to impose that. So basically, Governor Chris Christie seemed to be within his rights to do what he wanted to do.
Well, under our federal system, states really are the ones who make the policies and decide whether or not to quarantine people within the states. The federal government has authority at the borders, at the airports. Federal government also actually has legal authority to prevent the interstate movement of people with contagious disease, but they never really enforce that. They don't really have the means. CDC does not have the means to enforce it. So once someone enters the country, they really are under the jurisdiction of the states.
So the last time I was reading some comments you made earlier this week, the last time this kind of a quarantine was imposed and enforced by the state was the early 1990s with a tuberculosis outbreak, but those people were flagrantly, as I understand it, kind of in violation of quarantine respect.
Well, it's the last time it was done in a large numbers. We still have occasional quarantines here or there. There are more technically isolation orders for people with tuberculosis. But you're right, in those cases, what's really critical is these are folks who have been non-compliant.
Yeah.
They're not taking their medications, they're not following public health orders, and so the state is able to say that they have, good reason to believe that these people are not going to abide by their therapy. The situation here is quite different. We're dealing with healthcare workers. We have no reason to believe that they're not going to comply with less restrictive alternatives, like monitoring, like reporting into healthcare, public health folks daily or frequently. And so what the Governor Christie and Governor Cuomo did is really kind of jump the gun and go from, almost no controls to the most draconian
But, Wendy, I'm
controls.
sure you know this because you've thought about it, you've studied it. I mean, a lot of people are in favor of this. They're thinking, yeah, why take the chance? All right, she's got to spend a few days in a tent. Let's not worry about her. Let's worry about all of us.
No, I get that. I totally understand. I think that that is a understandable reaction. People are afraid. The problem is if we don't act with a nuanced, evidence-based approach, if we allow fear rather than sound public health policy, and frankly our Constitution, and here the Constitution and public health go together, we're going to hurt ourselves more in the long run. If we if we disincentivize healthcare workers from wanting to help people in Africa and here, we're hurting ourselves.
So if she files this lawsuit and if other people are given this same kind of treatment, would it be effective? You know, if a whole group of these healthcare workers filed some kind of a suit?
Well, I think her case is probably going to be pretty unique because my suspicion is we're not going to.
This is the end.
Well, my suspicion is they're not going to hold people in quite such a draconian environment again. At least I hope not. What's really important in these cases is courts do look, is this the least restrictive alternative? So, you know, is the state doing this in a careful way? The states can get this right. They can provide the controls and the reassurance that the public needs without going overboard and treating nurses like criminals.
All right. Wendy Parmet, thanks for joining us.
Thank you so much. It's been a pleasure.